So there are very limited options for treatment of these rare patients with familial hypercholesterolemias and also for familial chylomicronemias. The conventional therapies like statins or ezetimibe, bile acid sequestrants, they really don't work well in patients who have mutations in both their alleles and have extremely high levels of LDL cholesterol. The only option that has been used very effectively is LDL apheresis. So you hook the patient to a machine and you take care of you withdraw their LDL particles, return the blood to them, and that keeps their LDL low for a week or two. So they have to undergo this procedure on a weekly or biweekly basis, and that helps. Now, the exciting thing is that in the last year, there were 2 medications which were approved for treatment of patients with familial homozygous hypercholesterolemia. And one of them is called mipomersen or Kinamro, and the other one is lomitapide or gestapid. So these medications are very interesting. Mipomersen affects the production of apolipoprotein B in the liver and thereby reduces the production of very low density lipoprotein and low density lipoprotein therefore, and can reduce LDL cholesterol levels in those patients. And we see a lot of these patients who say, well, doc, I don't want to be connected to the machine. So there were no options earlier to treat these patients. Now we have either mipomersen. The second medication, lomitapide, works by inhibiting microsomal triglyceride transfer protein, which packs these cholesterol and triglycerides into very low density lipoprotein particle. And if you inhibit that, you are again reducing the formation of VLDL and thereby low density lipoprotein particles. There are certainly, these are new, there are side effects of these medications. Mostly they start affecting the liver fat, they accumulate liver triglycerides, so we have to watch for liver function tests. And down the road, we have to watch for whether there is any effect on causing hepatic fibrosis with these medications. But certainly, these are steps in the right direction. In terms of patients with familial chylomicronemia syndrome, those with lipoprotein lipase deficiency, the only treatment which is right now available to them is extremely low fat diet. We'll tell these patients that if you reduce your fat intake to about 10 to 15%, which is very hard to follow, you can reduce chylomicrons in your blood, and hopefully that can prevent recurrent attacks of pancreatitis that these patients suffer from. But as you can understand, that is not effective in many patients. So we are certainly looking forward for new therapies in familial hyperchylomicronemia syndrome. In European Union recently, the gene therapy for lipoprotein lipase deficiency was approved, and hopefully they will petition the FDA for approval or for whatever data FDA needs to consider it for approval, and we look forward to working with them about developing this therapy. I mentioned MTP inhibitors for familial hypercholesterolemia. These drugs, while they work on the liver in reducing VLDL formation, they can work on the intestine and reduce chylomicron formation also. So potentially these drugs should also be efficacious for patients with familial hyperchylomicronemia syndrome. And then there are other targets which people are exploiting. Pharmaceutical industry is exploiting angiopoietin-like factors. They are trying to inhibit them. Another cofactor, apolipoprotein C3, they are trying to inhibit to see whether such inhibition will improve outcomes in these patients actually. So Elaine, would you like to mention resources which are available to these patients with either homozygous familial hypercholesterolemia or familial chylomicronemia syndrome?
Well, first there's the Familial Hypercholesterolemia Foundation, but at NIH, in the National Heart, Lung, and Blood Institute, ever since I've been at NIH and continued through to this day, there's always a continued direct research interest in these families and these patient populations, and there's ongoing active clinical trials with patients with these conditions. There's major hospitals that specialize in these services, lipid clinics, one in Dallas, Seattle, in New York. And again, back to what we had said before, as our resource that I always like to plug is www.clinicaltrials.gov. Patients can type in keywords and see what active clinical trials are available.
So Vanessa, you mentioned that familial chylomicronemia registry, which is up and coming. What are the other registries that are very active in United States or elsewhere?
So then we have the Lipodystrophy Registry, Lipodystrophy United, the LD Connect program. Certainly with looking at FH, there's a Cascade FH program, very educational resource to look at online to better understand risk and screening. Then there's also a program out of British Columbia for FH as well. So all of those resources continue to provide a great educational source.
Yeah, and the familial chylomicronemia syndrome, this is very exciting to know that there is going to be a registry for that.
Right, and that will be LPLD Connect.
LPLD Connect, wonderful, very good.